Experts believe there are more people infected with coronavirus right now in Colorado than at any point in this pandemic.
The numbers certainly back that up. A record 6,400 cases were reported today. COVID is to blame for the deaths of 2,234 Coloradans since March. It was a factor in the deaths of 2,500 others.
And hospitals have us especially worried. 1,300 beds are occupied by patients suspected or confirmed to have the virus. And fearful of facilities running out of room or, not having enough employees, Governor Polis announced an executive order today requiring all hospitals to submit a detailed plan of attack by Wednesday.
If space is still limited, elective surgeries may be placed on the back burner. And if all else fails, the state will turn to makeshift hospitals like the one at the convention center.
There are several steps before it becomes that dire, but looking at the current trends across our country, including in Colorado, there is a higher likelihood that those might need to be activated. It is still something that is in our hands, in your hands, in our state's hands, in our country's hands to avoid if we show the resolve.
And the governor is basing his decisions not only on the numbers we're seeing today, but projections for the coming weeks.
And however strained they are, doctors tell our Sloan Dickey they have the resources and the know-how to handle the current caseload. It's the holidays that have them worried.
We're in a really serious situation right now.
As new COVID cases break records across the state of Colorado, health officials are speaking out.
I think what is clear is for the next few weeks, we will likely continue to see growth in hospitalizations.
It's back to the basics for every Coloradan: hand washing, masks, and most importantly, staying home.
I think the more we can act to prevent the hospitals filling up, to prevent the spread of infections, the better off our frontline workers will be.
In response to the staggering numbers, the governor signed an executive order today requiring hospitals to increase their emergency beds by 50%, as many ICUs are nearing capacity.
We're seeing what we would consider more conventional winter numbers where we're near 100% capacity at any given day.
Ryan Thornton, the chief nursing executive at Health One, says the new spike in COVID numbers is concerning.
Right now, our hospital systems in Health One are sitting right at that near full level, but not at full yet.
But there are emergency plans in place to handle the current wave.
It is serious, but we do have plans, and for right now, those plans are working.
But as the holiday season approaches, it's up to everyone, he says, to work at slowing the spread.
This holiday season may be the one that you want to really think through, how are we getting together? And is this really the right time to have that be within 6 feet of anybody?
And Coloradans can be assured that the health system is working just as hard to keep everyone safe.
We have fantastic emergency management systems here in this state and in this city, and the coordination of all of those peers has never been better.
Sloan Dickey, Denver 7.